Do you ever wonder what happens when you are getting crowns and what does a temporary look like? So in this case right here, we're doing the full arch that the patient has, and these are the actual temporary crowns. And so we do go ahead and we prep the teeth. In this case, the patient's getting an implant and she's having an extraction done. And so what we're doing is we're building the temporary right over that extraction site so she's never without a tooth. In my opinion, one of the biggest emergencies in dentistry is missing a tooth. You don't want to walk around with a missing tooth. And so we always make sure that if you're having a tooth extracted, we have something planned so that you can walk out with a tooth. And as you can see, this is made out of just 3D printed resin, which means it's plastic and very temporary, but it looks just so beautiful. And so I can show you also what we do is we also make a 3D printed model of what those teeth look like with the temporary on it. And so what's good about this is if we want to build the temporary ourselves for some reason, or if this one were to break, we have a backup ready to go. And so we just make a putty over this, and then we can shape that over the patient's teeth, and then they'll have their temporaries done. So in this case, what we're doing is we're actually opening up the patient's bite. So everything is crown and bridge, whether it's implants or traditional crowns over teeth, but we're doing the whole mouth so that we can open up the bite of the patient. What happens over time is you might grind your teeth, you might lose bone, and your bite will collapse, which means you get shorter, more wrinkles, and you look older. So many patients, they want us to open that bite so they can look younger and they can have that beautiful, wide smile that we always dreamed of.